For many people, the lack of social interaction caused by the pandemic has had a profound effect on their mental health. COVID-19 has impacted the mental health of millions of people in terms of the anxiety and fear it has caused and disruption to mental health services. People in long-term facilities such as care homes and psychiatric institutions are at increased risk of infection. Mental health professionals have themselves been infected with the virus, and some mental health facilities have been closed to convert them into treatment facilities for people with COVID-19. Mental health was already a neglected health issue globally. Close to 1 billion people are living with a mental disorder. 3 million people die every year from the harmful use of alcohol. And 1 person dies every 40 seconds by suicide. Yet, relatively few people have access to quality mental health services. In low and middle-income countries, more than 75% of people with mental, neurological, and substance use disorders receive no treatment for their condition at all. Stigma, discrimination, punitive legislation, and human rights abuses are still widespread. For this year's World Mental Health Day, WHO, together with our partner organizations, United for Global Mental Health and the World Federation for Mental Health, is calling for a massive scale-up in investments in mental health. On World Mental Health Day, the 10th of October, WHO will for the first time host a global online advocacy event on mental health. During this event, the big event for mental health, I will be joined by experts and household names from the worlds of music and sport to talk about what we can all do to improve our mental health. And you will hear their stories. Each and every individual has a story to tell about mental health. I will also be joined by world leaders who will explain why they are investing in improving the mental health of the people they serve. We will also show the incredible work being done and what more needs to be done to make sure that quality mental health care is available to everyone who needs it. Last month, I announced the establishment of the Independent Panel for Pandemic Preparedness and Response, IPPR, to evaluate the global response to the COVID-19 pandemic. The pandemic has been an acid test for many countries and organizations, as well as for the international health regulations, the legal instrument agreed by countries that govern preparedness and response for health emergencies. Even before the pandemic, I have spoken about how emergencies such as the Ebola outbreak in Eastern DRC have demonstrated that some elements of the IHR may need review, including the binary nature of the mechanism for declaring a public health emergency of the international concern. The international health regulations allow for a review committee to be established to evaluate the functioning of the IHR and to recommend changes to it. Earlier today, I informed WHO's member states that I plan to establish an IHR review committee to advise me on whether any changes to the IHR may be necessary to ensure this powerful tool of international law is as effective as possible. The committee will be made up of independent experts who will examine various aspects of the IHR. Although the review committee's remit is specific to the IHR, it will communicate with the Independent Panel for Pandemic Preparedness and Response and with the Independent Oversight Advisory Committee for the WHO Health Emergencies Program to exchange information and share findings. Depending on the progress it makes, the committee will present a progress report to the resumed World Health Assembly in November and a full report to the next year's Assembly in May. WHO is committed to ending the pandemic and to working with all countries to learn from it and to ensure that together we build a healthier, safer, fairer world that we want. I thank you.